Formula feeding for newborns. When breastfeeding isn't the best option, breastfeeding is a wonderful way to nourish your baby, but it's not always possible or safe. And that's okay. If you can't breastfeed, there's no need to feel guilty. Today's infant formulas are scientifically designed to support healthy growth and development. When babies may need formula instead. 1. Amino acid metabolism disorders. These rare genetic conditions affect how babies process certain proteins. One of the most common is phenylketonuria. Babies with PKU look healthy at birth, but without early diagnosis and a special diet, they risk serious brain damage. Symptoms may include vomiting, irritability, slow growth, seizures, light skin and hair, eczema, and a musty smell in urine or sweat. Treatment involves a low phenylalanine formula. Even breast milk must be carefully monitored. 2. Lactose intolerance. Some babies can't digest lactose due to low levels of the enzyme lactase. Symptoms: diarrhea, bloating, vomiting after feeding. Types: congenital, inherited, or late onset. Management: switch to a lactose-free or soy-based formula. Continued lactose intake can lead to liver issues, low blood sugar, and developmental delays. 3. Breast milk jaundice. Some babies develop jaundice from substance in breast milk. Management: pause breastfeeding for 48 hours. Then resume. If jaundice returns, repeat the pause. Most babies adjust after a few cycles. When mothers may need to pause or stop breastfeeding. Breastfeeding is safest when the mother is in good health. In some cases, it may need to be paused or avoided. 1. Infectious diseases, active tuberculosis, especially with positive sputum tests. Hepatitis B. If mom is HBsAg and HBeAg positive. HIV/AIDS. Breastfeeding is not recommended. Baby should be tested at 1, 4, and 6 months. 2. Metabolic conditions. Hyperthyroidism. Some medications may affect baby's thyroid. Hypothyroidism. Long-term hormone therapy may pose risks. Diabetes. If managed with medication, breastfeeding may not be safe until stabilized. 3. Kidney disease. Moms with kidney issues may need to limit protein intake, which affects milk quality and overall health. 4. Heart disease. Women with serious heart conditions may not tolerate the physical demands of breastfeeding. Medication use. Contraindicated drugs. Stop breastfeeding. Cautionary drugs. Time feedings to avoid peak drug levels. Acute infections. If mom has pneumonia or severe flu and needs antibiotics, pause breastfeeding and pump regularly to maintain supply. Discard milk during treatment. 7. Breast condition. Severe nipple cracks or mastitis may require a break. Express milk and feed with a spoon or dropper to avoid nipple confusion. 8. Postpartum recovery. If mom is recovering from serious complications, rest and express milk until she's ready to resume nursing. 9. Autoimmune conditions. Symptomatic lupus often requires immunosuppressants or steroids that can pass into breast milk and affect the baby. 10. Mental health and neurological disorders. Conditions like epilepsy may pose risks during feeding. Medications like phenytoin can enter breast milk and cause side effects in infants. Breast milk versus cow's milk. What's the difference? Breast milk is nature's perfect food for babies. It's uniquely designed to meet a newborn's nutritional needs and is easier for tiny tummies to digest than cow's milk. Compared to cow's milk, breast milk contains more lactose, lipase, vitamin D, unsaturated fats, iron, and cholesterol, a healthier calcium to phosphorus ratio that supports bone growth, less total protein, but a gentler, more digestible mix of whey and casein. This makes breast milk ideal for newborns, especially in the first few months of life. Is formula just as good? Infant formula, sometimes called humanized or modified formula, is made from cow's milk and adjusted to resemble breast milk. It typically reduces casein, adds essential nutrients like iron, vitamins, and fatty acids. However, formula can't fully replicate breast milk, it lacks secretory IgA, a key immune antibody, live immune cells like phagocytes, and lysozyme, lactoferrin, which helps fight bacteria. Breastfed babies often enjoy stronger immunity, fewer allergies, and smoother digestion. Plus, breast milk is naturally sterile, warm, and free. Choosing the right formula. What to avoid? Instant milk powder, quick to dissolve but tough to digest, high in sugar and gritty in texture. Sweetened milk powder contains over 50 grams of sugar per 100 grams, can lead to sugar cravings and poor appetite for solids. Unsweetened milk powder, lower sugar but still high in casein, which can be hard on the baby's stomach. Better choices: infant formula, cow's milk base with added soy protein, oils, simple sugars, vitamin D, and iron, gentler on digestion. Humanized formula, adjusted protein and fat ratios to mimic breast milk. Ideal for babies under 12 months. Can newborns drink fresh cow's milk? Not recommended. Fresh cow's milk contains about 2 times more protein than breast milk, mostly casein. High calcium levels that cause casein to clump in the stomach. Newborns have immature digestive systems and may struggle to process fresh milk, leading to spit up, gas, or discomfort. What's the best milk powder? Under 1 year, stick with infant or humanized formula. Over 1 year, fresh milk becomes more appropriate. Note: during formula production, some nutrients, especially vitamin C, can be lost, and fat particles may enlarge, making digestion slightly harder. How to choose quality formula? Look for airtight, undamaged packaging, clear production and expiration dates, recent trusted retailers to avoid counterfeit products. Good formula should be pale yellow, with a fine, even texture and a mild scent, dissolved completely in warm water, no clumps, no scent. Mixing breastfeeding and formula. Why mixed feeding is growing? Many parents face challenges like busy schedules, older maternal age, or low milk supply. Mixed feeding, using both breast milk and formula, is becoming more common and can be a practical solution. Common pitfalls: digestive upset from mixing milk types in one feed, difficulty tracking how much breast milk baby is getting, risk of nipple confusion or bottle refusal. Best practices: stick to one milk type per feeding session, either breast milk or formula. Prioritize breast milk when possible. Avoid long gaps between breastfeeding to maintain supply. Use breast milk for nighttime feeds, when supply tends to be higher and baby's needs are lower. If supplementing, keep nighttime routines calm and consistent for both mom and baby. 6 essential tips for formula feeding newborns. 1. How babies show hunger and fullness. Signs of hunger: urgent, frustrated crying, rooting, turning their head and searching for a nipple, eager latching when offered a bottle or breast, focused sucking, not easily distracted. Signs of fullness: sucking slows down or becomes inconsistent. Baby gets distracted or stops feeding to look around, turns head away, pushes nipple out with their tongue. Tip: newborns sleep a lot. If a nap lasts longer than 4 to 5 hours, gently wake them for a feed. But short naps don't always mean they're hungry. No need to feed every time they stir. 2. Should feeding intervals change at night? Not really. A newborn's stomach is tiny and can't hold much, so they need frequent feeds, day and night. As they grow, they'll naturally start sleeping longer stretches and needing fewer nighttime feeds. 3. What if baby feeds in starts and stops? It's common for babies to pause during feeds. They might be adjusting to the flow, catching their breath, or simply taking a break. As long as they're gaining weight and seem content, it's usually nothing to worry about. Want a case study style example here? I can create one to illustrate this more vividly. 4. Nighttime feeding risks to watch for. Feeding at night comes with unique challenges. Dim lighting can make it harder to spot milk overflow or signs of distress. Sleep-deprived caregivers may accidentally block baby's nose with the breast or bottle. In an effort to soothe quickly, some parents overfeed, leading to disrupted sleep patterns. Real case: one exhausted mom fed her baby while lying down in the dark. She fell asleep, and tragically, the baby suffocated due to milk blocking the airway. These incidents are rare, but awareness and safe feeding habits can prevent them. 5. Is it spit up or vomiting? Normal spit up. Baby seems comfortable. Small amounts of milk come up. Feeding and weight gain are normal. Bowel movements are regular. Problematic vomiting. Baby appears uncomfortable or distressed. Vomiting is large, forceful, or contains bile. Feeding amounts vary widely. Poor weight gain, lethargy, bloating, or abnormal stools. If you notice these signs, contact your pediatrician right away. 6. Do newborns need water or juice? No. Whether breastfed, formula-fed, or both, newborns should only have milk. Their digestive systems are still developing, and introducing other liquids like water or juice can interfere with nutrient absorption, weaken immunity, and cause diarrhea. Stick to breast milk or formula exclusively for the first 6 months.